Oh, are we on Facebook? We're on Facebook. Hi, Facebook, and indeed YouTube, Instagram. Sorry, it is not working. I'm going to say my live Q&A is not working. Join me on Facebook and YouTube. Right. Clearly, I'm a threat to Instagram, and they're trying to shut me down. But oh God, what? Oh God, what? I don't know what it is. Right, how do I stop that? Okay. Yeah, I don't know. My face, my. Do you know what? Is even the Facebook working? I don't know. Anyway, you know what? I'm gonna carry on because it. Share stories in a post or reel. I'm going to carry on because the show must go on. Yeah. Right, sorry, I'm just doing a video on Instagram. Bear with me, Facebook. This is a video to the Instagram people. I am not able to do my live Q&A. I'm able to do a recording like this, but I can't do it live. Don't know why. It says my account's not able to. I often upset people, to be honest with you, with the sort of stuff that I post, although I try not to show you know, body parts, but as you know, due to my job, sometimes body parts do get shown, and maybe it's that, I don't know. But anyway, I'll do this video to say sorry, but I am on YouTube and Facebook if you are on those platforms, so I'll be doing the live on those. Right, sorry, I'm just doing a video on the Instagram. Bear with me, Facebook. This is a video done. Right. Okay. Okay. Right. Professional, rise above it. Q&A. Oh, I did, and also I had a question on. I had a question on Instagram as well. So the question on Instagram was something along the lines of: Is the here we go? Is diastasis recti corrected during abdominoplasty procedure? So let me put it like this: you don't have to ask to have the diastasis recti. So if you don't know what diastasis recti is, it's the six-pack muscles, which are your rectus abdominis, which is one of them, and the recti is two of them, which actually go straight down either side of your belly button, and they've got tendinous intersections. They've got lines which give them the six-pack, sort of horizontal lines. But the muscles go straight down, and when you are pregnant or when you put on weight, the whole abdominal cavity can stretch, and those muscles can stretch apart, and that is called diastasis recti or divarification of the recti. It is just a fancy word for the same thing, which means that the muscles are a bit farther apart than we'd like, and you get a bit, sometimes you get a bit of a bulge centrally. And so it is an integral part of doing a tummy tuck that you assess those muscles, and that you usually, I would say, not 100% of the time, but the majority of the time, you have to bring them together. We call it repairing them. You're not really repairing them. You're just kind of bringing them closer together. So that is an integral part of a tummy tuck. You don't have to ask for it. It is there. But as I say, it's not 100% of the time. So If you didn't need to have it done, then we wouldn't do it. But the majority of patients do need to have it done. If your abdomen has been stretched enough for you to require a tummy tuck, in my experience, usually the muscles have been stretched to a degree. So we usually do it. And as I say, it's an integral part. You don't have to pay extra. You don't have to ask for it. I mean, by all means, you can ask for it, and we can talk about it. But some people don't really know it's there. The diverification. And we might just quietly repair it, and they might never have known. So yeah, the answer is yes, it is done as part of that. So thanks for that question on Instagram. I'm sorry I couldn't answer it on Instagram. In fact, maybe I should have done that when I did the video. But anyway, live and learn. Just thought about just now. I've got a list of questions here, which are looking at them. Abdominoplasty related quite heavily. Abdominoplasty, easy for me to say, related. So why don't I just kick off with this one? Can you have an abdominoplasty if you've had a previous open umbilical incisional hernia repair with mesh, January 2017, that was due to complication from prior surgery, laparoscopy and laparotomy in 2016? I answered this a little bit last week when someone was asking about, can you have an abdominoplasty with an umbilical incisional hernia repair? I don't know if it's the same question, but now this has given us a bit more information saying that they have a laparoscopy and laparotomy. So a laparoscopy, no problem. Laparoscopy is a telescope keyhole surgery. Laparotomy is actually having a cut in your abdomen and bowel, kind of open bowel surgery. And so that is potentially a problem. So the umbilical incisional hernia repair in itself is not a problem, but what might be a problem is the scarring that you have. And often with a laparotomy, it's a lower midline incision, which means it's below the belly button, down from the belly button down to the pubic area, straight line. And if that's the case, happy days, because that will all get removed. And that can cause quite a bit of distortion to the abdomen. So it's actually quite satisfying to remove those scars. The problem will come if there's any scar above the belly button. But if the skin scar is below the belly button, so if there's any scar above the belly button, either from the laparotomy or from the umbilical incisional hernia repair, that would be an issue and something we'd need to talk about. But if it's all below the belly button, then that would be okay. Do you need to know where the mesh is prior to abdominal surgery? If yes, is the scan done at your clinic, or do I need to do the scan prior to the consultation? Which scan is best to see the abdominal mesh? No, is the answer to that. No, we don't need to see the mesh. The mesh is often becomes integrated in your tissues. It can be difficult to see. It's on a scan. It's just basically a block of scar tissue. It's certainly good to know that it is there, but we don't need to know exactly where it is. We will find it when we do the surgery. The only issue with it is it might splint the abdominal rectus abdominis muscles. It might splint them, so it might make it a bit more difficult for the repair to be done, because there's a big block of mesh, or a block of scar, basically, which is what the mesh is doing. It's creating a big block of scar, which obviously reinforces the abdominal wall, so you don't get the hernia. But it can be difficult if we're trying to, plicate and contour the abdominal wall if there's a big block of scar tissue there. But we don't need to do a scan. We don't need to know where it is. We don't need to know where the mesh is prior to doing abdominoplasty surgery. Do you repair hernia in the epigastric region if one is found during the surgery? I'm experiencing hernia-like pain there, but no diagnosis of possible hernia yet. I had a clear CT of abdomen cavity, and due to have an ultrasound of my abdominal wall, not sure if the pain is in the hernia or damage from previous surgery. I mean, yeah, hernia is not necessarily painful. I'm not sure what hernia-like pain is. Hernia usually presents as a swelling or as a lump, which goes in and out. And if it gets incarcerated or strangulated, if it gets stuck, basically, it can be painful. But normally the sort of presenting symptom of hernia is a bulge that's coming in and out. So if someone has pain, I wouldn't necessarily go to thinking that's hernia first. It's probably more likely to be due to previous surgery or what have you. But if we find an incidental hernia at the time of an abdominoplasty, then yes, it's not unusual to find little defects in the abdominal wall. and to repair those during abdominoplasty. Obviously, if you've got a big symptomatic hernia, that's a different story that might need investigation and might need to be thought through differently, because a big hernia might need some kind of reinforcement of the abdominal wall in the form of a mesh, whereas a small hernia is often just a tiny little defect in the abdominal wall, which we can just stitch up, and often kind of gets repaired with the plication or the repair of the abdominal muscles. That small hernia often kind of is repaired just during that. So for sure, small hernias are fine to be repaired at the time. I've got abdominoplasty hernia central here. What are the pros and cons of carrying out abdominoplasty and epigastric hernia repair at the same time? Epigastric hernia repair. I don't. Who said anything about doing an epigastric hernia? So if you've got a small, usually periumbilical hernia, it will be repaired at the same time as an abdominoplasty, because the overriding operation is the abdominoplasty and the hernia is just incidental. If you've got an epigastric hernia, I think probably that should be looked at. Certainly an opinion should be made about whether that needs to be repaired, whether that's causing problems, or whether that needs to be paid separately to an abdominoplasty. You can do abdominoplasty and hernia repair at the same time, and the pro would obviously be that it's one operation rather than two. But the con is that if you have wound healing problems, if you have any issues with infection or anything, that can be bad with an abdominoplasty. And certainly if you're doing an abdominoplasty, your risks of wound healing problem and infection are significantly more than if you were just doing a hernia repair on its own. So if you did get a wound healing problem, if you did get an infection, particularly if a mesh is used for the hernia repair, if that mesh becomes exposed or infected, it would have to be removed, which can be an absolute nightmare. So it's not something that is commonly done, hernia repair and abdominoplasty. And usually if it was done, it's usually people who are often not very well. They've got a huge abdominal apron and they're just trying to do it for comfort rather than doing a formal cosmetic abdominoplasty. It's not a common combination. So usually I would say, let's, obviously good to have a discussion if you're going to have an abdominoplasty in the future, but I would have a discussion regarding the hernia repair, what needs to be done, and perhaps a discussion between the plastic surgeon and the general surgeon prior to doing the hernia repair, just to ensure that maximizing your ability to have an abdominoplasty in terms of the skin scarring that you get from the hernia repair. Oh, is that all right? If I get diagnosed with a hernia, epigastric, wow, is this right? Okay, can the hernia be repaired? Wow, this is some. Okay, if I get diagnosed with a hernia, epigastric, can the hernia be repaired at the same time as the abdominoplasty? Can this be done at your clinic? Who should I need to see? Right, no, none of this stuff we do at the clinic. We see patients at the clinic, but this would be done at a hospital. So tummy tucks, abdominoplasties are not done at the clinic, but obviously the doctors are based at the clinic. I don't do any of this stuff anymore. I've had enough, and I don't do any more of these sorts of things. But if you do get diagnosed with a hernia, can this be done at your clinic? No, it'd be done at the main hospital. Who should I need to see? Plastic and general? Yeah, exactly. So plastic surgeon at the clinic, general surgeon would not be at my clinic. We don't have any general surgeons working there, so you'd need to talk about the hernia repair with a general surgeon, and certainly plastic surgeons could talk to the general surgeon, but you would need to see two different people at different places, and the general surgeon will be at a different place. So yeah, you would need to. Wow, I want the hernia to be repaired using suture or human biomesh only. Is that possible at your clinic? What's the cost of hernia repair on top? So hernia repair is done by general surgeons. We don't have any at the clinic. We wouldn't do anything. We wouldn't do anything regarding the hernia repair. The hernia repair would be the remit of the general surgeon, and we would be just talking about abdominoplasty. So in terms of whether you're using suture or human biomesh only or whatever, that's completely the general surgeon. We would have no input on that. That would be a discussion between yourself and the general surgeon as to how the hernia is repaired and what would be the cost of the hernia repair. We talk about cost of abdominoplasty, but the cost of the hernia repair will be up to the general surgery and his or her team. Since having the plastic mesh repair, I've been having inflammation in my body, and I've been diagnosed with fibromyalgia and lupus. Can the mesh be removed by general surgeon and repaired with suture or human biomesh? Crikey. Don't know. You'd have to talk to the general surgeon. Very difficult to remove meshes. But as I say, it's not my specialty. Hernia is not my specialty. It's a general surgeon who you'd have to talk to about that. So I don't know if the mesh can be repaired, removed, or repaired. Well, if you're interested in meshes and hernias, this is the one for you. Will the abdominoplasty help prevent recurrent hernias? Will the abdominoplasty help prevent recurrent hernias? No. No. If you've got recurrent, so what? No. So hernia is basically a defect in the abdominal wall. Well, it can be in different areas, but let's just say abdominal wall hernias are defects in the abdominal wall. And no, not really. No, if you're prone to them, or if you can still get one even if you have an abdominoplasty. That's absolutely. Oh my God, we've got comments. We've got comments, guys. I've had my eye off the ball. Anemone. Hello, the anterior abdominal ultrasound I had today showed small defect in my wall muscle above belly button. Is this repairable by suture during abdominoplasty? Is this going to be an extra cost? What's the waiting time for consultation? The only thing I would be concerned about is, so on balance, if there was incidentally discovered that there was a small defect in the abdominal wall muscle above the belly button, that would be integrated into the abdominoplasty with no extra cost. The only thing that worries me a bit is that you say you've had an ultrasound, which presumably means you've got some symptoms there. So if you've got a symptomatic hernia, that will be a slightly different issue, which again, I go back to the general surgeon thing. That would need to have an opinion from a general surgeon, I think. As I say, the sorts of hernias we repair during an abdominoplasty are normally incidental, i.e. you are asymptomatic, you don't know they're there. If you are symptomatic, which presumably you are if you're having an ultrasound, then that would need to be discussed with a general surgeon, and the costs, the extra costs would be due to the general surgeon and seeing what they want or need, and there might be costs around hospitals, etc., if it needs to be done at a certain place. So it sounds a little bit more involved. What's the waiting time? What for? I mean, for a consultant with one of us, so it wouldn't be me. Just to be clear, it would be Costas. So a consultation with Costas, I'm not sure, a month. Amy knows. You can ring the clinic, Amy. I guess that a month. I don't know. I have no idea what his waiting time is. But it sounds like you would. I wouldn't imagine this would be done quickly if you need to get involved with a general surgeon as well. That would probably be quite a well. I don't know. Actually, you might be able to get an opinion from a general surgeon. I don't know. No hernia was found. Well, small defect in the wall muscle. Okay. Well, I don't know. It's hard to get into here. I mean, technically speaking, a defect. I guess it depends on the depth. A defect in the abdominal wall is a hernia. So I guess it's getting a bit semantic there, but I think anyway, yeah, okay. I don't know. This is a complicated case. Still got more questions here though. How dangerous? Where are we up to? How dangerous is it to have abdominoplasty plus possible epigastric hernia if you had an incisional umbilical abdominal hair repair with mesh? Not well. I guess the danger is infection. So anytime you have an abdominoplasty, there's a risk of infection. And if you either already have a mesh in place, which is your incisional umbilical hernia repair, or if a mesh is going to be placed with a possible epigastric hernia repair, that increases your risk of getting an infection in the mesh, which is a nightmare, to be quite frank. So that is the danger, I guess. If you've got a mesh in place or are having a mesh in place, it would be dangerous to have an abdominoplasty on top of that, because if you get a wound infection and that infection gets to the mesh, that's a serious complication. So something to think about, quite a lot to think about here. Would you offer to perform the abdominoplasty if I'm experiencing pain in my wall muscle but can't see what the cause is on scan or ultrasound? I'm not sure. It doesn't sound great, to be honest with you. It's not sounding great. And I think, you know, abdominoplasty is an elective procedure. It's a planned procedure. So you normally do it when people are in sort of good, optimal condition. If you're getting pain, if you're having undiagnosed abdominal pain, I probably wouldn't advise going down the route of having an abdominoplasty, which is quite a big elective procedure, whilst there's still something hanging in the balance. There's something going on potentially in your abdomen that we don't really know what it is. So that would probably mean, you know, look, general surgeons are the ones who deal with abdominal pains and, you know, intra-abdominal problems. So I would probably say, look, it's probably best to get that sorted, and it wouldn't be ideal to be having a cosmetic tummy tuck while you're having undiagnosed abdominal pain. I would like my muscle wall to be repaired ASAP, but if I still have a little bit of weight to lose after surgery, would that be okay? Let's say 1 stone. Again, muscle wall repair would be the surgeon, the general surgeon, rather than us, the plastic surgeon. So whether they do it when you've still got a bit of weight to lose would be up to their discretion. But in general terms, surgery is better when your weight is less. The tension will be off things, the repair will be tighter. So it is, generally speaking, better to do it when you have lost weight. And certainly the tummy tuck, if you're having a tummy tuck, for sure that is better to have once you've lost the weight, because if you have the tummy tuck and then you lose weight, you can get a bit of redundant skin. Not to mention the fact that your risk of complications, or we talk about hernia, hernia on the mind, talk about infection and what have you. Your risk of infection is higher, risk of wound breakdown is higher, so the complication rate is higher if you have if your weight is higher. So the ideally you would lose the weight first. I guess it depends a bit on where your weight is and what sort of timescales you're looking at. I don't know, you're saying you want it ASAP, but yeah, in general terms, for this sort of elective surgery, these you want to be in your best condition. So having your weight right first, and as I say, undiagnosed abdominal pain is probably not great. So it sounds like there's a few issues here which need a bit of thought and a bit of input, possibly from other surgeons other than plastic surgeons. To be frank, the thing that we do is usually pretty straightforward. You know, the tummy tuck side of things, bit of muscle repair, hernias, abdominal pain, all these sorts of things need a bit more of a bit more thought and a bit more input from a different type of specialist, which would be a general surgeon. So it sounds like you need a bit of input from your general surgeon. And as I say, the sort of stuff that we do, the tummy tuck side of things, is usually relatively straightforward. This one clearly isn't straightforward. This one's not straightforward at all, with all this hernia shenanigans going on. But a kind of inverted commas normal tummy tuck is relatively straight. I mean, don't want to say it's not a big op. It's a big op, and the risks, etc., etc. But the actual, you know, the actual sort of not dynamics, the sort of like the mechanics of what you do sort of thing is kind of relatively, bit of skin removed, bit of muscle tightening, contouring to the abdomen, getting the shape right. You know, it's kind of, it's all superficial surgery, and it's all kind of you know, relatively straightforward. But again, I guess I'm saying that because that's the sort of thing we do, and anything that you do is straightforward, I think. What we got? Davina, hello, Mr. Staiano. I had my bilateral mastopexy cancelled on the 12th of April due to asthma attack. Please advise how long I'll have to wait to have surgery. Also, typical one, Davina, but I would say to you, Davina, asthma is a serious condition, and you've got to be careful with asthma, because it can be, even in this day and age, it can be a serious thing. Two aspects that spring to mind. One aspect of it is, how are you? If you are still, did you have treatment? Did you have what was the sort of exacerbating cause? Was it an infection, or was there something that created your asthma attack? In which case, how is that? Is that settled? Are you back to normal? That's the number one aspect. So how are you? And the number two aspect is really going to be down to the anaesthetist, Davina, to be honest with you. To be honest, and the person who would have cancelled you would be the anaesthetist, really, because, I mean, obviously I would agree that it should be cancelled if you have an asthma attack, but it's not really a surgical problem, if you like. It's an anaesthetic problem, the asthma, and it's something the anaesthetist needs to manage. So that would need a discussion with the anaesthetist. So first of all, we need to make sure you are over the issue, if there was an issue, as I say, if there was an infection or a reason for the exacerbation of your asthma. And secondly, it will be a discussion with the anaesthetist. But I don't think we'll be rushing in, number one. And number two, we'd have to look at the hospitals, to see whether the anaesthetist is happy at all. I am personally finding that actually not so much the anaesthetists, it's more the hospitals are becoming a lot more, I don't know if risk averse is the right word, because I'm not saying they were sort of okay with risk before, but it's getting a lot more difficult with people with things, not that asthma's a minor thing, asthma's not a minor thing, but things which previously I was doing kind of no problem at all, didn't really even bat an eyelid. Now the hospital's like, oh no, we can't do it because patient's this, patient's that, patient's diabetic, patient's Jehovah's Witness, patient's do. So whereas before we're like, well, we did, so and so and so and so. So, and it's difficult in those circumstances, because at the end of the day, you begin to realize that you, or as in we, are surgeons who operate at hospitals, and if the hospital says no, we haven't got a hospital to work at. So I think they are getting more and more, what's the word, select, or more and more anxious about patients with medical conditions. I think there's also, maybe it was more so in COVID, but there's also sort of like feeling that they are worried about people potentially having a problem, maybe getting transferred to NHS, putting burden on the NHS. I think that was more of an issue on around COVID. Very rarely happens anyway in anyone, but I think there was a big concern about that. So if anyone had a medical condition that they were worried, we don't really want to put pressure on the NHS. Certainly around the COVID time, when the NHS was in real capacity sort of thing. So oh, hello. Thank you. I'm well now. GP happy recovery. Was caused by a bad cold and received nebulizers, antibiotics, steroids. Good news. Eager to have my first surgery before I finish my maternity leave. Yes, Davina, that's very common. Totally understood. Message received and understood. Davina, probably Amy or Nicola or someone like that would be looking at that, and they would be, I guess the next stage is, when was it? 12th of April. It wasn't that long ago, Davina, was it? 12th of April. I mean, that's 11 days ago. Yeah. Anyway, it'll be an anaesthetist thing, but I'm glad that you're feeling better, Davina. And the way I'd look at it, Davina, if I was you, is we're trying to do the right thing for you. And sometimes it can be frustrating, especially when you've got things like your maternity leave and what have you. And it can be frustrating. Oh, crikey, just get on with it. Come on, it's all right. But in fact, everyone, and, as I say, it will be driven by the anaesthetist and the hospital, this, rather than the surgeon. If they do say, oh, we're not comfortable, then they're doing it kind of for your good, although I completely understand that it can be frustrating. But anyway, yeah. So I haven't got a specific answer, Davina, but I'm saying to you, 11 days is not that long ago. So and asthma is a serious thing, not to be taken lightly. I think sometimes people have this image of asthma as being like football pitch, bit of a puffer, bit of a breathlessness, but it can be serious. So we do take asthma quite seriously. Oh wait, not a hernia thing. How much do you charge to repair a hernia? So Lynn, if you have got a hernia, it's probably best to get that kind of investigated and looked at by a general surgeon. If you're going to have a tummy tuck, because general surgeons or abdominal surgeons, they treat hernias. If you're going to have a tummy tuck, it's good for the general surgeon to liaise with the plastic surgeon about incisions and placement of scars and stuff such like, because you've got to be careful if you're going to have a hernia repair followed by a tummy tuck. But personally, as I said earlier, I wouldn't be that keen about doing a hernia repair and a tummy tuck at the same time if it's a significant hernia. Sometimes we discover small incidental hernias and we just repair them as part of the tummy tuck. No extra charge, it's just part of the tummy tuck. There's just small defects in the abdominal wall which we repair. So if it's one of those, it's no extra charge. But these people have not got symptomatic hernias. These people didn't know they were there, and we just found them while doing the tummy tuck. If you know you've got a hernia, then that suggests it's going to be bigger than these ones that I'm talking about, which are very, very like tiny, these ones I'm talking about. So if it's a significant defect in the abdominal wall, it might need more than just to sort of stitch up. It might need some investigation. It might need things like mesh. They often do mesh repairs now. It might need some more involved surgery, which might make it potentially not suitable to have at the same time as a tummy tuck, but the surgeon should talk to the plastic surgeon about incisional replacement. And B, if it was, it may require a general surgeon to be with a plastic surgeon to do the surgery, and that would obviously require extra costs. How much? I don't know, because it would be the general surgeon who would be charging for that. So I don't know how much the general surgeon would be. I was going to say I know how much a tummy tuck is. To be honest with you, I don't even know how much a tummy tuck is. But, we know, if you contact Amy and stuff, she'll say this is how much a tummy tuck is. But if it's a tummy tuck joint procedure with general surgeon, different level of complexity, you can expect it to be a lot more, to be frank, because there'll be two surgeons doing your operation. So that will increase the cost of that. Wow. That was a theme, that, wasn't it? That was a tummy tuck hernia theme. It was a theme of the day. Lynn, thank you, because that was jolly good of you. Lynn, Davina, Anemone, thank you for participating. Thank you for putting your oars in. Oars very gratefully received. So that was a good one. I think we done hernia and abdominoplasty. I hope so. Hope you've clarified that. Anemone, thank you for your questions. And I do think I need to lie down after that, to be quite honest with you. So I don't know about you. I'm going to have a lie down. If you do have any questions about hernias, about tummy tucks, or about anything else, then message on the YouTube or the Facebook or the Instagram. Although this isn't working on Instagram, but we can post on Instagram. But for some reason, the live's not working on Instagram. So by all means, if you do any of those things, then you can message on there. And I have got reason to believe I'll be back next Tuesday. Will I? Is there anything happening in my life? I don't know. I'll probably be back next Tuesday. So I will see you all then. Thank you all for the questions, and the participation is very, very gratefully received. So go and put your feet up and have a good evening. I bid you good night.